Good morning, everyone. How are you doing? Sorry I'm a little late. I had to deal with my daughter this morning, but everything is good now. So, anyway, welcome to EH&S Planning, and wanted to introduce you to myself. I'm 9 years in the United States Marine Corps. I spent 30 years in the construction industry, and I was a union electrician for approximately 9 years, in and out a little bit while I was developing a construction company, which was technically a maintenance and repair company. And so I got a little bit of experience there, 9 years in the Marine Corps. And of course, let's see, I was a union carpenter for a very short time as well. So sorry about the glare here. I just realized I had a glare there. Anyway, hope you're all having a great morning. And I apologize for, like I said, for being a little late, but I had to take care of some things. At any rate, I just wanted to touch bases with you on environmental health and safety. With my years of experience in the construction industry and with the ongoing onset of COVID 19 and so forth, so just wanted to go over a couple of topics. I wanted to get your feedback and so forth. So, a couple of things about myself. I am a OSHA Authorized Outreach Trainer. I have been doing that for approximately 2.5 years, 2 summers ago, I believe, or almost three now. I also am a CHST certified construction health safety technician, certified through the Board of Certified Safety Professionals. And I'm also on the OSHA.gov.org website. If you go onto the trainers, searching for a trainer in Dublin, California, I'll go ahead, I'll pop up for OSHA 10 hour and 30 hour. So if you need a trainer for teaching that, let me know. I'll be glad to work with you on that. I did develop a company called EHS Planning, Environmental Health and Safety Planning, creating a umbrella. I've had the opportunity to network with many safety professionals, starting with Mobile Medic. That is a healthcare provider who specializes in mobile medical help for you and your team out in the field. If you have a worker that gets injured out in the field, they'll come out to you and take care of all your needs, short of you having to dial 911 and get them to emergency. This is for the non-life threatening urgent matters. Well, it could be an urgent matter. Um, yeah, so actually, that's asking me to write something. Hold on 1 second while I write something real quick. Here to answer your questions. All right. So here to answer questions. Let's dive deep. Um, and I think I see a couple of people here that are on the live here. So this is my first time doing a live. So I want to go ahead and I'm going to put one moment here while there we go. Oop, I did the time wrong. Yeah, hold on 1 second here while I type this properly here. I need to type in a time even though I started already, so which is fine. All right, let's see if we can click this on Facebook. Oh, I wanted to do LinkedIn. Shoot. Come join my live now. Hold on. Sorry about that. it was kind of weird. This thing just popped up and it said, "Hey, type this now." So I'm typing it now. Let me put this on my story and my news feed. Okay. So apparently it wanted me to share this on Facebook. That was weird. Okay, that's fine. Let's try LinkedIn. See if anybody's on LinkedIn today. Let's see if we can get some live streaming. Live streaming individuals. Okay. Okay. Let's put some hashtags. OSHA. Health and safety, workplace safety. Safety first. Construction industry. Zoom. Training. Compliance. Tools of the trade. There, that should be fine. Okay. Let's see if we can get this. Okay, perfect. Thank you for your patience, whoever is on with me right now. So I appreciate your diligence. All right, let's see if we can get some more folks here. Okay. Here we go. So, okay. So, sorry about that. That is done. So, let's get into it. Let me see if I can share my screen here. I've got a couple of things I want to go over. Let me see. Okay, so that got copy. Okay, so that's copy. And that went on my, oh, I see. Gotcha. Let me add something here. Perfect. Just copying and pasting a few things. Oh, I see what happened. Oh, I see. I'm over my limit in words. That'll let me save. Ah, perfect. Okay. We're just adding we're just adding things on right now, that's all. Okay, so that's enough on LinkedIn. Perfect. I've got like 5 LinkedIn's open. I'm not sure why. Let's just close them down. Let's go back to the streaming. So we have a lot going on regarding safety. Matter of fact, I'm just going to go over a few things. EH&S, we do certifications. So if you too would like to get a certification, this here is one of my students, and she just completed her CPR, AED, and first aid, CPR and AED for adult, infant, and pediatrics, basically adult, infant, pediatrics. So yeah, if you'd like to get some training done, let us know. So we had a lot of requests come in recently about some of the trainings that we've been doing, and I had an opportunity to put a few things together. Um, so I'd like to talk about business continuity planning, and I had this conversation recently with a few team members that I've been networking with, and that's where I was talking. That's what I was talking about earlier about networking. So I talked to you about the mobile medical team. So if you are interested in having any of those services, it'd be great if you can reach out to us and let us know what your thoughts are. At the very least, allow us to put a proposal together for you. Let's see, ISO 31,000 and the 14,001. And I'd like to know what your thoughts are on the Hillard chemical manufacturing. Um, there is a ton of things that we can go over. So EH&S planning, like I started leading to, is we have created that to be like an umbrella company, and we've networked with many different organizations and different people. Networked with the industrial hygienists, have networked with also a few companies in the hazardous waste area, HAZWAPER, transportation, and that is a great opportunity for you to get involved with that. So, a gentleman by the name of Robert Weisley, he is amazing and he does great training. So he has networked with us, and that's been going really, really well. In addition to that, we also have with Mobile Medic. They're an amazing team. They're starting to hit the ground running pretty hard and catching up to a lot of companies are using on-site. On-site, from my understanding, are getting pretty big, and Mobile Medic is offering amazing service. And with that service is exceptional doctors, a team of doctors that she has, Dr. Letitia Hashmet, and we've networked with this organization, and they've been just doing a fantastic job with respirator fit testing and medical clearance. Excuse me, medical clearance and screening, and that has been going really, really well. A few other people I'd like to mention is oh, just real quick. So if you need respirator testing or fit testing, I have a team of safety professionals who have been helping out EH&S as independent contracting, and that's been going really, really well. So let's see, COVID. So these are the topics I want to go over today. COVID-19, infection prevention and control, and how to properly clean and disinfect surfaces. You actually can chime in and ask questions there on the bottom there. If you'd like to ask some questions, you're welcome to do that. I have definitely, first of all, can you guys hear me okay? I just realized that I see my mic here. Okay, now it should be on then. Gotcha, okay. So we have this. I'm just looking at some of these tools here. So we can definitely, so any questions that you have, just definitely chime in. I'll see a notification when when something pops up. I'd like to be able to do share screening. So let me see if I have that. Pop out, toggle timestamp. Okay. We can definitely do questions here, but I don't think I can add anything here. I don't see a share button. Perfect. Okay. Anyway, I'm kind of all over at the moment, but I do have notes. I also want to talk about getting into the labor law, and there's a couple of folks that I've reached out to and talked to in the environmental health and safety field regarding legal matters. And of course, the pandemic, the oh, excuse me, I missed something regarding the attorneys, the newsletters. Um, it's important to put together a nice newsletter to get that out to your team, just to keep everyone involved and on top of what's going on. And I'd like to take a quick moment to shout out uh, Quebec, Quebec Pro. Quebec Pro is our sponsor today, and they are doing an amazing job with the drop object protection program. Do you have a drop object protection program currently? If you don't, think about it. ANSI came up with the standard a few years ago, drop object protection, and drop object protection is a new thing. And a lot of people are kind of hemming and hawing about it. But realistically, drop object isn't any different than safety glasses. When safety glasses came around, matter of fact, people still bark about having to put on their safety glasses. And of course, you have hard hats. And matter of fact, I have a sample right here. Maybe. Yes. Oh, I thought I had it right here. Drop object protection is huge, with the sense that you're required to wear hard hats now. Not only are you required to wear hard hats, but safety shoes, reflective vests on a construction site, for example. Safety shoes, ear protection, hard hat, and of course safety glasses and gloves, depending on what you're doing. And that's a thing now. So ANSI wrote these standards years ago, and OSHA adopted them. So the drop object protection is the newest thing that's going on right now. So having a drop object protection program is important. And if it's something that you'd like to know more about, here, let me go ahead and type it here. If you go to, let's see, so actually, I'll get the code in a second. I don't have it in front of me. I didn't even think about grabbing it. But I actually have it. Oh, I have it right here on my phone. Give me 1 second while I pull it up. So drop object protection is tool lanyards. It's retractable safety devices that you attach to your tools when a worker is working in an elevated surface, working at a height greater than 6 feet, or it could be 3 feet. Actually, it depends on what you're over. So there is a lot of it depends on your surface that you're working above and what the potential risk is. So if you happen to be working right next to a bunch of rebar sticking up that don't have any safety caps on them, you know, whether you're 1 foot up or 6 feet up above that, number one, you want to make sure that you minimize your risk. And what if someone was working there and you're above them, regardless if there are any rebar there sticking up? You want to make sure that if you dropped a tool, your tool isn't going to smash and come down and smash someone. So that's why there is retractable tool lanyards now. Our sponsor is Quebec Pro. And I'm going to type that in a second here. I just wanted to get all the details because there is a code that I could that I can add for you, and it will, there it is. Okay, so let me type this in 1 second here. So just as I thought, https://www.key, where'd I go? quebec.com/discount/EHS planning 20. Yes. So check out this link here. I just put it in the description there. If you want to check out the link, that'll show you what I'm trying to explain to you. It's tool lanyards, and they have an opportunity to save your tools, minimize risk, and help your tool if you do drop it, not damage your tool or injure or break anything down below, like someone's head, especially if it swings and you have a drill that's nearby. It could hit someone. Anyway, let me go back to my list here. Let's discuss. So you can put your questions in the bottom there if you'd like to come check it out. But I also want to talk to you about ergonomics. Ergonomics is a big thing. I see a lot of YouTube videos and a lot of LinkedIn videos. Matter of fact, I saw one someone posted yesterday about a man working at a bottle plant, water bottle plant, and those big 5-gallon containers. He was just chucking them, twisting his trunk, and throwing them from the conveyor belt. He was moving them and throwing them into. He was doing two into a hole, into those stacked up crates that they use for transportation. And I mean, you do that like a whole bunch of times, you're going to definitely have a workers' comp issue and a claim really soon. Actually, got to turn on the AC. Getting a little cold, a little hot in here. But basically, the um, ergonomic issues definitely happen. And have you been thinking about that? How do you minimize the risk? Well, you start out with engineering. Well, not specifically, but there's many factors. But depending on where you're at, engineering controls is one of those. If you're not sure exactly what engineering controls are, um, you can Google that. Um, I don't have the function to share my screen. I thought I did. That would have been fun, but I don't. So no big deal. However, engineering controls is a way of engineering out the safety hazard and the challenge, the risk, the potential risk. Maybe you don't see it right away, but repetition, moving your body the same way every single day, um, over time, it's going to wear your body down, um, from sore, achy muscles to eventually damaging your ligaments to muscular skeletal issues, and so forth. So there is a ton of things that need to be kept in mind when creating a process at your work. It doesn't even have to be your work. What if it's an organization? What if you're volunteering doing something? If you do a repetitive motion, the same thing over and over and over again, eventually it's going to wear on you. And you're going to have to be icing anti-inflammatories and, immobilizing that part of your sore body that you are overusing. And I kind of left that vague because it could be your fingers, it could be your eyeball staring at the computer too long. So there's a lot of issues and challenges. So and you need to incorporate cross training, teaching other people how to do it, so you're not stuck doing the same job all day long. You also have to keep in mind that not only do you want to cross train and train others that can do the same thing, and rotate that person around so they can do various other tasks, and also include breaks. Like right now, I just put on my fan because I'm getting a little warm here. Must be the lights or whatever. But the point is, you want to make sure that you're able to minimize your risk. Do what you need to do. Stand up, take some breaks, do some stretching. When I worked at Tesla Motors, that was something that we did. Um, each shift, when they did a startup meeting, part of that startup meeting would consist of stretches, just doing different body functions and stretches, and just to get limber. Because if you think about it, you know, they're 8 hours of, yeah, maybe 6.5 with breaks and lunch, and sometimes you just got to take a moment to rest a minute, especially if you're doing a physical job. Someone doing a really physical job or even a non-physical job, you still want to get up, move around, stretch, go get some water. Of course, you want to have nutrition. You want to have some snacks throughout the day, to eat properly, have your proper nutritional lunch. your breakfast, your lunch, your meal, your snacks. You want to eat healthy. You want to you want to eat right. You want to take the appropriate amount of breaks, and you don't want fatigue to kick in. You don't want ergonomic repetitive motion injuries to formulate, and of course you don't want to have any uh, environmental like lung issues. You want to make sure you're in an area that your environment is good, your air quality that you're breathing in is good. So there's a lot of aspects about that. So yeah, so if you can send me, we're going to do this again. Today we're just going to do 30 minutes. I've been on for about 25. I'm just going to go another 5 minutes. But I just wanted to give you all an opportunity to know what we're going to be talking about. At the end of the day, we want to keep you and your loved ones safe. Um, and my next talk, I'm going to talk about safety culture, because if you're in leadership and you're having workers' comp claims coming in, what could be the problem? What could be the issue? Are there too many OSHA recordables? A lot of first aid, medicals? What is going on with your organization? Whether it's work, a team, an event, or some public type thing going on, where is your leading cause? Where are your indicators at? And what's occurring? Have you had someone like a safety professional like myself come in to do a walkthrough, a site visit, do an evaluation, make some recommendations? Then you want to assign action owners and find out what's going on. These are the things that you want to look at and think about when you're having some challenges. Some people are just hiring people for full time just to fill a position, but they're not giving them the resources to successfully take care of the challenge at hand. If you have a poor safety culture, then that's not a good thing. You can't make your team do something. You can't be safety cop. You have to create a program where your environment wants to change. Your environment, when I say environment, I'm talking about your employees, your team, your organization, your body of your people, where your incidents and injuries are occurring. What if it's just an event and you can't control that? Because, well, you have to set expectations and you have to create visual control aids to make things right. And of course, you have to also enforce disciplinary and set examples if those who are not wanting to follow it. So there's a whole broad spectrum of uh, set criteria that you can develop with a leadership team, with a safety committee, which that's what I do. I help you design, create, and do an in-depth um, dive into your safety books, your emergency management program, and everything. So anyway, um, there's a lot to talk about in safety. Some people don't want to talk about safety, but safety is important. I would be glad to work with you and your team to help develop a safety program. And can I help you develop a safety culture, a safe safety culture? And that is something that is important. Um, let me help you develop that. Let's plan that. And the first step is a phone call, an email, reaching out to me. And other than that, I want to thank you all today for joining me. I'm going to wrap this up. Like I said, today's only a 30-minute talk, just a prelude of future talks. And I thank you very much. And I look forward to having some more questions and answers for you, and diving deep into safety cultures, and the dynamics of um, just all the services that are involved with having a successful team. No one individual can create and design and uh, execute a good safety leadership team. It takes a village. Thank you so much, and you have a wonderful day. I'll see you next time.